Welcome everyone. My name is Patricia Vermeulen. I'm the CEO of AMREF in the Netherlands. It's my pleasure to welcome you all to the second day of the Africa Health Agenda International Conference 2021. Yesterday, we were joined by over 2,000 participants from around the world. For those of you who joined us yesterday, thank you for your engagement. We had a number of dynamic sessions focusing on leadership for UHC with distinguished speakers, including His Excellency President Uhuru Kenyatta, WHO Director General Dr. Tedros Adhanom, Dr. John Nkengasong from Africa CDC, and the Ministers of Health of Kenya, Rwanda, and Ethiopia, and many others. We also celebrated International Women's Day with some of Africa's foremost women leaders in health, including Honorable Minister Liat of Ethiopia and Dr. Matshidiso Moeti, Regional Director of WHO Afro. Today will serve as a rallying point for advancing UHC in Africa and rethinking health security in a post-pandemic world. We have a number of exciting sessions lined up for you today. So in a few minutes, we'll kick off the day with the plenary, Build Back Better, Health Security Beyond COVID-19. The plenary will take a deep dive into health security and preparedness in Africa, and the country-led systems and strategies that we must put in place to prevent another widespread disease outbreak. Our distinguished panelists include Dr. Matshidiso Moeti, WHO Regional Director for Africa, and Dr. John Nkengasong, Director of Africa CDC. Welcome, Dr. Moeti and Dr. Nkengasong. We are grateful that you're joining us today for this very important discussion. We will have a lot of parallel sessions this afternoon for you to choose from, varying a wide range of health topics, organized by esteemed partners. I won't go into all the topics that you can choose from this afternoon, but please have a look at the detailed program and make a decision. We're also excited for a high-level roundtable that will address one of the most pressing health questions facing Africa today. Where do we stand in the global race for COVID-19 vaccines? The roundtable will feature leadership from WHO, Gavi, Africa CDC, CEPI, and the government of Guinea-Bissau to discuss access, affordability, and delivery of COVID-19 vaccines in Africa. Participants will have the opportunity as well to join one of two guided networking sessions where you can interact and engage with your fellow delegates from the continent and across the world. I would also like to share a few housekeeping announcements, because all sessions you can access through the auditorium on the conference platform. You can find the link to the auditorium on the top left-hand corner of the conference platform. Once each session ends, please return to the auditorium to select your next session. You can simply click on the Join link that will appear once a session goes live. Interpretation is available for both English and French. To access interpretation, you can click on the globe icon, which is available on the bottom of your screen. You can do this once you're in a session. All live sessions are powered by Zoom. We recommend that you download and install Zoom on your computer or your laptop or mobile phone. This will give you the best user experience. When you use the browser, you will not be able to use, for example, the interpretation service. And finally, please do take some time today to also visit the exhibition hall, where you can learn more from our partners and the work that they are doing to advance UHC in Africa. Before we jump into our exciting program for today, I would like to share 2 short videos with you that will set the scene for the plenary discussion that we are about to hear. These videos give us a snapshot of how nonprofits have been responding in emergency situations and some information on building back better in Africa.
We're using amazing detection dogs so we can find bushfire survivors and care for the lucky animals that survived the fires, and ensuring that they have a home to return to.
There she goes. Il coronavirus ha messo a dura prova la nostra comunità. Noi di Croce Rossa, oltre che dare una risposta sanitaria, ne diamo anche una sociale, attraverso la donazione di pacchi viveri e di beni di prima necessità.
Signora, arriviamo? Eccoci arrivati, signora!
Estamos a combater a pobreza habitacional e reconstruímos casas às pessoas que mais precisam.
Eu estou agradecido, muito grato.
En Vive Bailando, el baile es nuestra herramienta para generar desarrollo social, para transformar positivamente.
We are educating people about how to avoid snake bites because over 50,000 people die of snake bites every year.
We are providing medical services to pregnant women in rural Kenya so these women have the dignity of a healthy pregnancy and childbirth.
We created a roadmap for a future where Black women's work is valued and respected.
We're clearing landmines here so that Cambodia can start to recover from the horrors of war.
Got myself some lovely oxygen because there isn't much in here.
I'm expecting a second video. I definitely think these videos do set the scene and the tone for today. Now, without further ado, please join me in welcoming Dr. Solomon Zodu, Deputy Director for Africa at the Bill and Melinda Gates Foundation, who will be moderating today's plenary, Building Back Better. Have a great day.
So thank you, Patricia. I welcome everyone. I'm hoping that this is going to be an amazing session. I've heard a lot about yesterday's session. I only was able to meet a little bit of it, but the bar has been set quite high, is what I'm told. So I better be my best behavior and make sure that I treat my panelists well and carry on the legacy. Without too much going into too many details, I just wanted to go through a little bit of housekeeping stuff, set the context, and then introduce our panelists, and then move on to being able to interact with them as well as have your questions answered. So as it was mentioned early on, today is the second day of a 2 or 3 day session. I can't remember exactly, but it's the second day. The video was quite animating. In fact, I have the music in my ear still, keeping me quite happy and peppy. So it's about building back better. This year has been quite an interesting year for all of us, and it speaks towards the health security beyond COVID-19. I am Dr. Solomon Zodu, as advised early on. So just to set a little bit of context before I move on to introducing our panelists, which I'll take very short amount of time. So a bit of a background, COVID-19 pandemic has revealed how glaring gaps in health security and health system preparedness can really impact us, and how we fail to prevent, and failing to prevent the spread of disease and outbreaks. So to ensure Africa does not have to face a crippling effect of another pandemic, we need to really be well planned and integrate responses to improve health securities and building healthy societies. This plenary will discuss the state of health security, as in, what is Africa's plan, what needs to be included in the African plan, who are the key players, and also discuss the urgency, concrete actions of the African government need to take so that we are better prepared for the future pandemic. I'm sure you all have heard that it's not if, but when the next pandemic currently takes place, where will we be at that time? Early on, my colleague Patricia has went ahead and introduced a couple of the 5 panelists. I will go through the 5 with no particular manner, as presented on my paper, and then before we go to the details of the individuals that are going to be on this panel. First one is Dr. Matshidiso Moeti, Regional Director for Africa, WHO. Dr. John Kangerson as number 2 Director, CDC Africa. Greg Perry, the Assistant Director General for IFPMA, and I'll go through what the acronym is. Dr. Martin Fitchett, Head of the Global Public Health at Johnson & Johnson. Dr. Tandeka, I'm sorry. I'm so excited about the last name that I'm even messing up the first name. So there's a clicking sound here that I'm not mastered yet, but I'll just do the best I can. Kobo, and you'll correct me if that's okay with you. Also a medical director, executive board member of Godi Saman Youth Empowering Foundation, corporate affair officer in Kobo Empire, and quite a dynamic young person that we have amongst us. The session will probably run between 2:20 now to 3:05. Before the end of it, a few minutes before the end, we'll have a video on Africa health statistics. Will be prompted in your chat section that you will follow up, and then we'll come back and I'll have the great pleasure of closing. It was mentioned earlier on that there's a translation both English and French. Please do put your questions in the chat section. We will be monitoring the chat section and highlighting some of the questions. As you will know, the shortcoming of these sessions is the fact that we always run out of time with so many to talk about, and not particularly address everybody's questions, but do please put your questions in there. In order to maximize time, we'll also be talking about having 2 to 3 minutes per session, per question, per panelist, to make sure that we have a very dynamic conversation that goes on between us. So without any further ado, I'm just going to do a brief introduction of our panelists. By no means is these little few sentences on the individual could do them justice, but I'll do my very best in highlighting some of the things that are quite impressive in their short bios. So Dr. Moeti, hi again, nice to see you. Regional Director for Africa, WHO, is the first woman to occupy this position. She was recently confirmed by the WHO Executive Board after her resounding re-election for second term. Congratulations again, belated, but definitely a moment to be celebrated. Over the past 5 years, Dr. Moeti had led the transformation agenda that was widely acknowledged to have improved the performance and effectiveness of the organization. She made tremendous progress through, I'm sorry for the background noise, I'm in South Africa and there's many high performance cars passing by, so my apologies. So Dr. Moeti has improved the performance and effectiveness of the organization. She has made tremendous progress through transformation agenda, which includes improved response capacity to health emergencies like COVID pandemic, Ebola, and others. The flagship of this transformation agenda has been the successful eradication of wild polio, which were all celebrated earlier this year or late last year. The transformation agenda has since been adopted to inform WHO global reforms, and congratulations on that. Dr. Moeti is a medical doctor and a public health expert with more than 40 years of national and international experience. She has worked with the WHO Regional Office for Africa, where she has led several senior positions since 1999. Dr. Moeti successfully led WHO's 3x5 initiative, which most of you, I'm sure, are very much aware, in the Africa region, which aimed to expand access to antiretrovirals in countries. And prior to joining WHO, Dr. Moeti worked with UNAIDS as the team leader for the Africa and Middle East desk in Geneva, with UNICEF as a regional advisor, and at Botswana's Ministry of Health in various capacities. In recognition of her excellence, service to humanity, Dr. Moeti has received many accolades, including an honorary fellow from the London School of Tropical Medicine, an honorary doctorate of science for the University of Health of Applied Sciences in Ghana. She is a great champion for women in leadership and the global health. Moving on to Dr. John Kengeson, dear friend, and hopefully you're keeping Ethiopia safe for me. Dr. Kengeson is the director of the Africa CDC and controller at CDC and prevention. Prior to his current position, he served as an acting deputy principal director to the Center for Global Health, United States CDC, and chief of International Laboratory Branch Division of Global HIV and TB at the US CDC. He has received numerous awards for his work, including the Shepherd Award, the William Watson Medal of Excellence, the highest recognition awarded by CDC, and a recipient of the Knight of Honor Medal by the government of Cote d'Ivoire for a significant contribution to public health. He is an adjunct professor at the Emory School of Public Health, Emory University, Atlanta, Georgia, and serves on several international advisory boards in the coalition, such as the Coalition of CEPI, Coalition for Epidemic Preparedness Initiative, and the International AIDS Vaccine Initiative, AIVI, among many others. Moving on to Greg Perry, Assistant Director General, International Federations of Pharmaceutical Manufacturers and Association. Greg is an Assistant Director General in the International Federation of Pharmaceutical Manufacturers and Association. He is responsible for the agency's external outreach, the association's external outreach and stakeholder engagement in global health topics, including innovation, access, and the international regulatory environment. Greg Perry brought with him more than 20 years of leadership and advocacy experience in the public health arena. Prior to joining IFPMA, Greg worked as Executive Director for the Medicines Patent Pool, which he joined in 2013 as a Director General for the European Generic Medicines Association from 1999 to 2013 in Brussels. Previously, he worked as the partner in the UK Public Affairs Company as a European Union policy advisor to corporate and non-governmental organizations. and before that as a parliamentary advisor to members of the European Parliament. Greg is a member of the Advisory Council of the Organization for Professional and Regulatory Affairs, TOPRA, and is former member of the Standing Advisory Committee before the European Patent Office, SASEPO. Greg also holds a Golden Cross of Merit from the Republic of Poland. Dr. Martin Fitchett, and I hope I'm saying your last name properly, with a name like Zodu, I've heard it all. Everybody's butchered my name, so forgive me for saying that. Dr. Fitchett, MD, is head of global public health at Johnson & Johnson, where he leads the organization fully dedicated to addressing some of the highest unmet needs and healthcare challenges facing the world's most vulnerable and underserved population. Martin brings more than 20 years of experience as a proven researcher and research and development leader with a focus on accelerating development and access to transformational innovation for those in lower to middle income countries through an end-to-end approach. Under his leadership, the GPH team combines R&D, global access strategies and programs, and local operations to advance the critical solution that saves lives, cures patients, and prevents diseases from those impacted by tuberculosis, HIV, mental health, and other public health challenges. Martin has held numerous leadership positions across the J&J, leveraging leadership and vision in the R&D across therapeutic areas. Prior to joining J&J, he held scientific leadership positions in medical affairs and research and development in metabolic and diabetic at Sanofi, Adventis, and Novartis. Last but not least, Dr. Tandeka, medical doctor, executive board member, Godisanan Youth Empowering Foundation, corporate affairs officer of Nkobo Empire. Dr. Tandeka is a charismatic young medical doctor from KwaZulu-Natal, South Africa, who beat the odds and continues to bloom wherever she's planted. She is registered as a health professional counsel in South Africa as an independent medical practitioner and currently practices as a medical officer in Rietvlei, I have to learn these words soon, District Hospital. She completed her matric at the age of 17 and on to pursue her medical studies at the University of KwaZulu-Natal, where she graduated with Bachelor of Medicine and Bachelor of Science. When she isn't treating patients, she serves as a corporate affairs officer at Nkobo Empire, an Afrocentric multimedia company. Her latest business venture is the acquisition of Magua Steel Limited, a steel manufacturing company for which she's a majority stakeholder or shareholder. The company aims to recruit more women into the constructive industry. Dr. Nkobo is also a board member of Godisanan Youth Empowering Foundation, an NPO helping to develop various rural communities and empower other young people. Having been a teenager mother herself, she remains vocal about issues of teenage pregnancy and preparation to launch her very own nonprofit organization is underway. So let's look out for that. She is one of the 2018 top 100 young leaders in the SADC region, 2018 Nail and Guardian top 20 young South African who were inspiring change and greatness. She would like to be known as one of the young professional women who followed her dreams and made it against the odds. A medical practitioner who is always prepared to serve beyond her line of duty to inspire and grow Africa. So these are our very impressive panels participants. I will go directly into our session of asking questions. To our panelists, what I will do is I'll crisscross among the various panelists in order to make sure that we keep you engaged. I will have my colleagues participating in vetting questions that are put in the chat to make sure that we have an opportunity to address them. So let me, without any further ado, let me start with Dr. Moeti. So COVID-19 is the starkest wake-up call yet that Africa, that countries around the world need to take urgent steps to strengthen health systems, not only to deliver quality health services, but to be resilient against future pandemics. As the countries invest in controlling the pandemic, what must African leaders do to already prepare for future disease outbreaks and health emergencies? Dr. Moeti, please.
Okay, thank you very much. First, thanks for having invited me to this panel. I'm looking forward very much to a rich conversation. So indeed, it's already been said, and the film said it very eloquently, that this has been a massive wake-up call to our health systems, to our societies, to our economies, that there is a need to be more resilient to the external shocks presented by epidemics, and especially by this pandemic. And this can be achieved, we think, by accelerating action towards the twin goals of achieving universal health coverage and improving preparedness for health emergencies in an integrated way, so that the one feeds into the other, and also for expand this to prepare for their socioeconomic impact. That's been so profound that we cannot have an isolated approach to health and then deal with the social and the economic impacts separately. It all has to be done together. So over the past year, we've seen countries face challenges in delivering the type of care that's needed, as well as ensuring the continuous delivery of healthcare services. So it means then that your healthcare delivery also should be prepared to withstand the kind of shocks that can be presented by a pandemic, and therefore have the capacity to adapt, to adjust, and to make sure that the types of capacities, tools that are needed are put into operation. We talk a lot in the context of developing health systems that will deliver universal health coverage about the role of communities, and we'd like to reaffirm that communities do indeed play an extremely important role. And therefore, their role needs to be validated and needs to be part of an ongoing, if you like, structure and mechanisms of a national health system, so that they are contributing not only to service delivery or information sharing at the community level, but also to the governance of the healthcare system, and most importantly, also to preparedness to withstand the shocks of something like a pandemic. And so then going beyond communities are civil society organizations and groups, because they are best able to start to see that something unusual is happening in this locality. It needs to be taken note of by the system, so that systems that are dealing with surveillance can kick in a timely fashion, and that we have the ability to respond in a timely way. We've seen also the tremendous potential of digital health and e-health as part of universal health coverage, preparedness, and very much as part of the response to this pandemic. There's been a lot of efforts on the African continent to incorporate these as mainstream components of what goes on in health. African health leaders have to see to it that the environment is created where the different players can come on board and ensure that digital technology becomes a key tool in health development, including in building the resilience for the health systems. Of course, one big issue is investment in health, the financing of health. And we've seen this stagnating per capita in most African countries in the past few years, and would like to strongly commend that there's nothing has proved better than this pandemic, that investing in health, investing in the health system, in resilience is a massively good investment in terms of returns when you now need to respond to a pandemic like this. And we're recommending countries move from the currently around $60 per capita to up to $90 for low-income countries, and up to 117 or more for the higher income countries in the region. As far as the leaders are concerned, we know that there are existing national high-level mechanisms, as well as legislation and policies for responding to and preparing for epidemics, pandemics, emergencies. These need to better take on board health. What we know, what we've observed is that there are multi-sectoral mechanisms, and the health sector is participating not in an optimal way and tends to have its own separate mechanisms. We would recommend that these be brought together so that we have a shared view at the level of national leaders of what needs to be done to protect for health, to protect for economies, to protect most vulnerable people, and put in place the social safety nets that they will need as part of preparedness. And then finally, just to say, development more broadly needs to be better prepared to respond and to withstand such shocks. So we can no longer say, oh, today schools must close, tomorrow it's factories are closing. Our national leaders need to ensure that the national development plans have a significant component of resilience, preparedness, after having seen what can happen with a shock like the pandemic. And then this needs to go beyond the national borders to the regional economic communities, right up to the African Union, in terms of how to work together then to form the kind of coalitions of governments, of the private sector, civil society, communities, in order to build back better and be more resilient to the next pandemic that confronts us. Thank you very much.
Thank you, Dr. Moeti. So echoing the sentiments about a comprehensive approach, interoperability between sectors, and really that puts the African leaders in the middle of this decision making. So at all levels. So let me move on to Dr. John Kengeson and talk about on the same line with African leaders. We know that there were some massive deliberations and great outcomes from the most recent African Union summit. The AU Bureau Heads of State and Council of Ministers must be applauded for their leadership during this pandemic. So could you give us a little bit of context on what were the key outcomes from these discussions during the AU summit that would help us build better and deal with the next pandemic? John?
Thank you. Thank you, Solomon. And once more, let me extend my greetings to the entire AMREF family for pulling together such an extraordinary meeting on health in Africa. And the title of the meeting is very interesting and thought-provoking, which speaks about the African strategy. And the Building Back Better, I like it so much. And the video that was played was interesting. It talked about building back better, but bolder and bigger. And I like to emphasize on those two other words, the being bolder and doing it bigger. I start with that because we are 1 year, 2 months into this pandemic, and you can actually begin to write the report of this pandemic and as to what went right and what went wrong and what we should do. And if I was part of a commission that was asked to write this report, I would actually tell them that I know what to do. I would take those reports that were written after the Ebola outbreak in West Africa, change Ebola and put in COVID-19, and you have a report in 2 days. So we actually know usually what we need to do. We can actually list those things very well, or take old reports and recycle them and ask the question, what is it that we are not doing well? One thing, when I've been reflecting on this pandemic and then reflecting on the Ebola outbreak in West Africa seriously, and you ask yourself the question that you end up being more confused at the end of your reflection than at the beginning. You say, what is it out there that is making us collectively us, the political leadership, the technical leadership, the policy leadership, difficult to see that diseases are a serious threat to our economy? They are a serious threat to our health security and a serious threat to our own existence, given what we have seen all through the history of diseases, including the 1918 pandemic. So, and I'll come back to that because there are some lessons that we truly need to learn from the 1918 pandemic. During the summit, as you said, to be very specific, I have always, my last 4 years here at the Africa CDC have actually enabled me to look at the instruments, the tremendous instruments that exist within the African Union, which is always led by a head of states. But however, the gap in translation of those instruments into reality. And I think that is that value of debt that we should be thinking of and say, what is it that we must do to make sure that the nice reports that are always written, everybody knows what we need to do, but it's not really done. So the head of states were they acknowledged that this is a serious threat. The COVID is a serious threat. it was almost universal that head of state after head of state took the floor and talked about the impact of COVID. And they also acknowledged that the fight is still ahead, which was a very good thing. And then they expressed serious commitments to both delivery of vaccines, including the acquisitions and the distribution, as well as to intellectual transfer of knowledge, so that we can, as a continent, begin to embark on continental manufacturing of those instruments that are so important for us to move forward. Just to, as an example, they also committed or urged the Afro-Exim Bank to raise more capital to fund some of these instruments, i.e. vaccines acquisitions. So I have, the beginning of this pandemic, we always said that one of the reasons that Africa did well was because of the leadership of member states, the political leadership included. And I think that you continue to see that strong expression of political will, political commitment across the board, across nearly all head of states at the summit. The fact that they recognize themselves that they have to invest in their own instruments, like the Africa CDC. I think head of state after head of state took the floor and argued for the strengthening and the autonomy of Africa CDC independently. I've never seen that in my last couple of summits I've attended. It speaks to the fact that this pandemic has shaken all of us to the core. And I think that is very clear. When I reflect, as I mentioned earlier, I've been giving a lot of thoughts to what is missing. There are really what I come to summarize as understanding the pathogen, understanding the population, understanding policies, and understanding politics. That all of this, we have to try to bring all together so that the things that Dr. Moeti listed out there can actually be implemented and effected on. I mean, a poor understanding of a pathogen is a problem. The people that fought the pandemic in 1918 just didn't know what they were doing about the pathogen. They actually only could invent a vaccine way after the pandemic in around the 1930s. But here we are with tremendous advances in knowledge and science that within just a couple of weeks, we could analyze the sequences of this virus, develop diagnostic tests, and within a year come out with a vaccine, to the point that we are vaccinating people in the world. Tremendous advances there. The population, we still have some work to be done, as we've discussed earlier, I mean, engaging the community so that these tools that are developed, i.e. the vaccines are actually used in the community, is something that we have to deal with. But where I really want to focus on is the policy and politics. I mean, if we do not bring the politics and policy alignment together, whatever we do in the pathogen area, whatever we do in the population level will be missed. And I believe that is an interface that we need to work hard so that all the things that we know that have to be in place to have a better, bolder, and bigger system must come together. So let me just conclude by saying that in discussing this topic of building back better, building back bolder and bigger is really to look at what is challenging us as a continent. And there are three pockets of dimensions that are challenging us. We are still dealing with a pandemic. The HIV is still a pandemic, which is not behind us. I mean, COVID, as we will realize after COVID is over, is that it has actually worsened the HIV pandemic and maybe the TB. So those endemic diseases, we have to look at them. I've always argued that the best way to prepare for this health security is to invest on those endemic diseases, the TB, the malarias, the tuberculosis, and the HIV, so that if we get them right, then we can deploy those systems to fight any incoming enemy. Then the emerging and re-emerging infectious diseases, including Ebola. I don't think Ebola is over. As we speak, we have 2 countries in Africa. We are struggling with Ebola. And of course, the non-communicable disease. Unless and until we bring these endemics together and look at the intersection of these endemics, we'll continue to write nice reports and shelve them, and reports that really don't report anything, and think or develop policies that don't go anywhere. So I think the leadership, the political leadership is very, very aware that we have to now bring the technical issues and policy issues to the level of the political leadership for action. Thank you, Solomon.
Thank you, John. So just to go ahead and quote you, the fight is still ahead. So now that we have political leadership that is quite adamant about being aligned and making sure that they hold the downstream accountable to better policies and better politics, let me go to Dr. Martin and see what the upstream R&D is thinking about this. So other pharmaceutical companies have made large investment in R&D for vaccine, and John alluded to that. And therefore, understandably, they care about the price that they can command with those vaccines. However, most often, the highest payer is not the most vulnerable in socioeconomic and heartfelt health effects of diseases. How can pharmaceutical companies play a role in ensuring that low to middle countries are not left behind during global emergencies, health emergencies? What mechanisms can help drive this? From your J&J context, could you comment on this particular upstream R&D that needs to find a good medium for downstream coordination?
Yes, thank you very much, Solomon, for your kind introduction, and to my fellow panelists. It's wonderful to be here and looking forward to a very interesting discussion. So in terms of, if we think about our major contribution to the current pandemic, it's been really one of innovation. We had the innovation platforms in terms of the products that we could bring. We didn't know we could bring them as fast and as rapidly as we could, but we contributed with the core innovation. But it wasn't an accident, or one was built up with decades of scientific research. As we say, the time period that it took, and we all know, was around 12 months for up to 3 vaccines to be successfully launched in most markets. But the time was miraculous, but the fact that it was done was due to many decades of investment in research and platforms. Now, what is also exposed is the fact that these platforms have different profiles, but many different vaccines will probably be needed for the initial response, and probably in the short to medium term as well. And so that also tells us that we need to continue to invest in vaccine technology to ensure that we have the appropriate level of response. In fact, we're here at the CEPI 2.0 and other organizations are talking about much more accelerated targets for the future in getting the vaccines from say, genomic sequencing into patients. So one thing that we would like to, and we feel we have a responsibility to play a role in, is actually building on that technology base, which I think for all pandemics is going to be core and essential, but it's obviously not the only essential capability that's going to be needed. It needs to be surrounded by many other capabilities, which we also operate in an industry level, but we have to share and partner with other organizations very closely as well. Also, if we think about the historical research that was underway, I think it happened because we had some investment, I think investment in commercial platforms mainly for the vaccine strategies and franchises that companies had. But I think we're all now going to have to think about a much more structured and proactive approach to preparing for a pandemic or one of these major outbreaks. And although we have obviously the global pandemic of COVID-19, there are actually great lessons that we could have applied from prior responses, which were actually quite successful, in particular the 2014 Ebola epidemic. And the Ebola outbreak was probably one of the first times that we had such concerted investment across industry, companies, non-governmental organizations together with regulators to really drive forward very rapid development of a vaccine, which we now have 2 approved vaccines for Ebola. And as you said, there are also, as John just said, there's now 2 very worrying and active outbreaks in 2 parts of Africa again, and these outbreaks are becoming more frequent. So the other thing I'd say is we also have to apply the technological learnings from Ebola, Ebola to COVID, probably also to other areas of enormous medical need, particularly in Africa, which have also had a great deal of, I would say, problem keeping up with their demand and the patient care that's needed, where all the resources have been diverted to COVID. And we need to think about everything else around COVID or the next pandemic, because there could also be catastrophic lapses in care delivery. And so the platforms and the technologies we also apply to core pandemic outbreaks in the future, we should also think very, very carefully about how we also apply them to support the diseases that are left in the wake. And the evidence is just compelling. But the main areas we work in, like tuberculosis, multi-drug resistant tuberculosis, and mental health and HIV, they've been devastated in some parts of Africa in terms of access to hospitals for a couple of reasons. And people didn't want to go to hospitals in COVID either, not to get COVID. There weren't the resources, they weren't prioritized. So it's not just the availability of core medical resources, it's a whole factor, a whole slew of reasons. And these will be a big issue for us all to work on, even as we're working on the, I'm hoping we will be getting to a point with the pandemic where we are planning rather than reacting. And so also, I think one thing that's been really important is I was happy the industry was able to make some concerted effort, and I believe a considerable concerted effort on behalf of us and the core companies that were part of, I think, the Bill Gates Roundtable Declaration to allocate significant volumes of vaccine to low and middle income countries. So far, I think 297 million doses of COVID in total, I think, have been delivered to about 111 countries. But I acknowledge that the African countries and some other low and middle income countries are probably running about, I would have estimated, about 4 to 6 months late. That's not good enough, but it's an improvement of what we thought we would have been able to achieve before the pandemic. And I think it will improve as the understanding of which vaccines are going to be used where is rapidly understood. And one of the underlying messages I wanted to make is it's not all bad news from terms of a response, at least from where I sit. The pandemic was clearly an absolutely devastating, personally, medically, and economically, blight on the world. But we got vaccines to the market in generally the timeline we said we would. And we also, I think, showed, at least from, where I work in the public health department, a remarkable coordination and understanding between government, between the private sector, non-profits. Very, very rapid decisions were being made, more than I've ever experienced as an R&D physician working in standard R&D. And actually probably more than I've experienced in previous emergencies, for obvious reasons. And so that there were some good news stories there. And I believe we have to understand, and even we have to build on those and be better. We'll be setting ourselves much more aggressive targets, I think, as a global community for a future response. I think the CEPI was one of 90 days or something. I'm trying to remember what it was, but okay, let's try it. But also to do that, we also got to learn from how the different technologies performed. I think the RNA vaccines were proven to be very effective. The other platforms also effective. I think the jury is out, but I also believe that we just need to understand and have a concerted effort, but we probably need to make a much bigger proactive investment in platform technology across the board. So if I think about what we think we need to do in general in the future, I would just say, let's just do it and not say we're going to do it and then not do it. It sounds an obvious thing to say, but I hope that what happened to everybody, what impacted everything from medical to human loss to economies collapsing, will for once teach us as a planet not to just look after the disaster and move on. And I'm confident we will. but I'm an optimistic person. There are things we will need to do as a global community. And maybe I think we also have a huge opportunity in Africa because of the amazing work, I think, of the AU working with, or certainly slightly independently of COVAX, led by, I think, incredible visionary and effective leaders. I think getting a significant proportion of vaccine, may have ambitions to get herd immunity in the continent within a reasonable frame of time, which gives me enormous hope that we can also work together to develop the necessary parts of the infrastructure in the continent that will also be needed. And so those infrastructures are not subject to nationalism. They can be everywhere where they're needed. And we all talk about the ideas of having, the warm, ready production plants. And I think we do need to think about for Africa, having significant vaccines.
I hate to end, Mark. Yeah,
right.
we express for time that is. Let's end on that hope.
All right.
Yeah, and let's just do it. It sounds like a great Nike commercial. Just do it. Looking forward to having a much broader narrative, a conversation moving forward. But on that note, since you talked about the opportunity on the continent, I'd like to go to Greg. And there's a growing sentiment that if countries on the continent are to ensure access to health to everyone, they need to be able to locally produce drugs, vaccines, and diagnostics. To your point, Martin, you made sure that there was a recognition of the huge intellect and the potential of the continent. Greg, do you see countries seizing this opportunity to significantly shift the status quo and recenter expertise, capabilities, and capacities in the region? Not to say that this is a replacing mechanism, but a complement